Hi, it's Kelly and welcome back to Room 9 3/4. Today we are going to be talking about splints. So throughout this video series, we'll be talking about all the splints that you would be responsible for as a tech in the department. So Will Kennedy, our tech in the hospital's orthopedic tech, will be helping us out in these videos, just showing you all step by step how to do each splint. So before we start, we're going to talk about everything you need to do before your splint and after your splint. So before your splint, you're going to need to make sure that you have, again, the right patient, the right extremity, all of that good stuff. And then you're also going to need to make sure that the extremity is clean and dry, that there's no open wounds or anything like that the doctor needs to be aware of. And then you need to do your pre-neurovascular checks on the patient. So PMS, cap refill, all that good stuff. And then after your splinting process is finished, you need to do those same neurovascular checks. Pulses you might not be able to get to, but cap refill definitely. And then you'll need to tell the patient it might be warm for a little bit. You'll need the doctor or MP, whoever asked you to do the splint, to come look at it after you have completed the splint. You'll need to tell them not to get it wet, not to stick anything down into their splint, not to cut their splint off or change it until they have their follow-up appointment. And again, to tell anyone if they feel severe pain or numbness or tingling in that extremity. So if you have any questions, feel free to reach out to the education department or the splint book or these videos. So happy splinting.
All right, so I'm back here with Kelly, awesome, from education, and we're going to be doing a volar and dorsal wrist splint this time, okay? So first of all, you're going to assess your extremity. You're going to check pulse motor sensory, check cap refill, check pulses. Kelly, do you feel me touching your arm?
Mm-hmm.
Cool. Alrighty, and then for this splint, we're going to want to use the shorter, the 4-inch padding, the 4-inch plaster. If you have a very small, like an infant patient or a really old lady with small arms, you can use a 3-inch plaster for a lot of the wrist splints. Just, fit it to where it looks proportionally the same on your patient. If you're doing an ulnar gutter and you have a really big guy, you might have to use a 6-inch. But for most patients, a 4-inch should work fine. So again, we're going to measure on the unaffected extremity. So it would be that one. And we're going to go from this joint right here, okay? That's where we want our plaster to end up, all right? So we're going to go a little above that joint. And then we're going to measure to, let's say here. You don't have to go all the way down the forearm on this. All right, now we have our piece. We're going to start rolling out our plaster. You probably need a little less than 2 4-inch ones. Well, maybe half of them. Alrighty, and same here, we'll just go 2, 4, 6, 8, 10.
Yeah, and again, super important that you're getting your 10 layers of plaster on here so that if these patients are to be discharged, that these are stable enough for them to live and do their normal daily activities with the splint on, and that it's not going to go anywhere or fold into any other shapes.
Absolutely. And don't go crazy with it. If you go too far over 10, there's an increasingly serious risk of thermal burns, and that's how we get sued. Alrighty, so now we have our plaster measured out. We're going to start soft rolling. So we'll be doing a volar and a dorsal splint. You wouldn't be doing both of them at the same time. A volar will go on this side, like I said, from this joint here, as far down the arm as you go. And then dorsal is going to be just flip-flop it. Same joint there, as far as you can go.
Yeah, so just for time's sake of the video, we're going to do just 2 and 1. But again, this would be either one side or the other side based on what the physician asked for.
Right. So we're going to start in with our soft roll. Now you got these bony prominences on the wrist that you want to be really worried about. So like I said, we're going to do some extra wrapping on those. You can just go over more times, or you can just do more layers right there before you start. As for the thumb hole, you can either make a thumb hole or you can flip the wrapping like this and just come through the middle. It's always an option. Thumb hole looks better. Let's see here. Perfect. All right. Now we got the wrist padded properly. Now remember, we're just going to do an overlap of 50%. And we're going to make sure we're not pulling because we're not trying to make a pressure dressing. You always want to go down a little further than you intend to go with your plaster so you can roll back up. And then we'll finish this roll out. All right. Do one final thumb. All right. Now you can let the patient set their arm down while you get your plaster wet.
Yeah, and again, if you need someone to help hold your patient either by the fingertips to help keep this in the right spot for you, so put your splint on, that can also be helpful, or hold down here by the elbow to help them hold it up and keep it in alignment.
Oh, don't tie their hand to anything. I've seen that done before. I'm going to roll out another plaster for the dorsal side. Alrighty.
And again, you can kind of do these. This is a good way to do it because it just helps you get these two layers in at once. If you want to go individually and lay down, you can do that as well.
Right.
It's kind of just personal preference.
Yeah. As long as we have 10 even layers. Like I said, I like to fold them end over end because that way you have at least one side that you know won't have a hard edge. So one. So we're 2, 4, 6, 8, 10. That might have been 12. 2. No, that's
And just always double check your work.
Yeah, always safe to count. Very easy to count the layers. Okay. So I'm going to go ahead and get my first piece of plaster here wet. Same thing here. We're going to use hot water, or we'll say warm water. Squeeze all that water out so we're not sitting here for an hour trying to set it. Okay. Like I said, we're going to apply right on that joint. Perfect. Okay. Now, once again, we'll do one layer of our web roll to hold this on. If you were just doing a volar, you would just stop right here, do a couple layers of this web roll, and then be done with your splinting material. I'm just going to put one layer to hold this on while I wet my dorsal side. If you want your thumb holes to look really good, then make sure you know, it won't be perfectly in line with
it
where
feels
the
good.
thumb is now.
Yeah, and so this is going to be your volar, and then you're going to kind of, again, just like you would your other ones, you're going to kind of form it until it starts to harden up here.
Really cup, but like I said, always with the palm of the hand, never the fingertips.
So just like we did with our other splints, yeah, you do want to form it here. I can form it a little bit while Will wets the dorsal side.
So you don't want it flat, all right? You want your position a little more like this. Can't remember the quite word for it. but a nice natural bend of the wrist, like if you were holding on to something like that. Okay, so just you see we got a nice natural bend to the wrist here. Okay, that's still wet, but it's fine. Alrighty, so
I'll
you just
continue the
keep
formation.
forming until it starts to harden there. Alrighty, now we're going to go in with our dorsal side. Looks like we're a little too long here, so what you want to do there is just fold it. It's most important that plaster never touches skin. Okay. Then we'll go in with our web roll, our soft roll. Remember to overlap about 50% of your roll.
And then again, just make sure that, while you're doing this, you can also you don't want the patient to move any joint that you're trying to splint, but again, make sure they can wiggle their fingers, all that good stuff. You can do that kind of in between this too as you're forming it.
So then same for this one. If you didn't have a volar side, you're just looking for that nice angle of the hand there. Like I said, you want to cup, but not with the fingers. You don't want to create ridges in the cast that could irritate the skin. Okay. Then we'll go in with our stockinette and cover everything up.
Yeah. Yeah, and again, same stuff in the kind of the beginning of the video. Make sure that you're telling them, while you're throughout this process, what they should be looking for in terms of things to worry about or come back for, and then again, things not to do while they have their splint on.
Oftentimes, the patients are fairly concerned with the heat, and letting them know that that heat will subside is generally pretty comforting. So just let them know that it's going to get hot, obviously, while it's setting. Perfect. So for the bias, just make sure that we're not rolling it too tight, just nice and soft. Normally I'd like you to flip the roll, but just roll it really nice and soft. We don't want it to be a pressure dressing here.
Yeah.
That's why they don't let us use ace bandages.
Yeah, that is a thing that you might, see in some of our newer employees is they'll go to grab the ace bandage instead of the bias or stockinette, and it is really, kind of evidence-based that we use this instead of the ace bandage for that comfort of the patient, and again, not to have it too tight. And as you can see, Will here to make the thumb hole in the bias is just taking a little snip out of it, the middle of it there, which is kind of, again, what you want to do. It's just going to be better for your patient's thumb.
Okay. And then here we're just going to, I'll show you all a tie off as opposed to, so like I said, you can always just throw 2 pieces of tape on the end, but a good way to secure it is to cut the end of the stockinette and then tie it off on the other side here. And you just tie it off.
Yeah. And again, like we've said in our previous split videos, this might be a better option for patients getting discharged because then this is kind of more secure than the tape and the tape falling off and then the bias becoming unrolled.
Yeah. So like I said at the end of the video, you're always going to want to roll your your web roll over. Make sure that we don't have any plaster touching Kelly's skin here. We're going to check our pulse motor sensory up here. Make sure that web roll stays up. Okay. We're going to check that Kelly can still feel me touching her. We're going to check her cap refill. And then we're going to have someone give it a look over.
And that is how you're going to do your Volar and your dorsal splints.